hope you enjoyed that bit called Slick and Chic. And we jump straight into Start Living Again after obesity surgery. And as you can see, all right, some interesting facts about it. Bariatric surgery, weight loss surgery includes a variety of procedures performed on people who are obese. Weight loss is achieved by reducing the size of the stomach with a gastric band or through removal of a portion of the stomach or by resecting and rerouting the small intestines to a small stomach pouch or gastric bypass surgery. So
that's right.
That's exactly what we're going to be featuring right here on HOT for today. And in the studio, we'd like to introduce you to, of course, Doc on call.
Yeah,
right.
We've got Doctor on in the studio to tell us more about this post-obesity surgery. We have next to me Professor Dr. Chin Kin Fa, Professor and Senior Consultant Surgeon, Harley Street Group, and of course Nick Noor Hasfida, Nick Mohammad Hasnuddin, who's the patient, and we'll just refer to her as Fida. Now, Fida, if you notice, this is Fida, or rather, this was.
This is the before.
That's after.
That would be.
Check that out. I mean, seriously. I should get her to stand up. Fida, can you just stand up a little bit for us? There
Fida
you go.
Before.
Awesome. So you've got Fida in here, and you've got Fida in the studios with us. Check that out. That's amazing. Oh.
Yeah, make a half turn, please. Half turn, please. Yeah.
All right. Any gonna say CCK, okay?
You know, I'm trying to figure out whether she's wearing the same floral outfit.
It looks like it, a little bit different color. Okay, 2282-857, 822-828-579. Give us a call, Malaysia, if you have any questions for the doctor. But meanwhile, let's jump right into it. What is this surgery that we're talking about? Now, earlier on we mentioned, you know, how Dr. Oz on Oprah years ago talked about tying up the stomach. And he did something similar, reducing the weight of the patient, one of his patients. So are we talking about the same situation or same surgery?
Basically, there are three different types of surgery that we can perform. One is by using a lap band that you talk about, using a band to restrict the amount of food that can go through a stomach.
Right.
And the other one is Fida had is a bypass surgery, which we do through keyhole surgery by making a small stomach pouch and then use a small intestine to bypass that to achieve the weight loss. This is a very important surgery because not only that it helps to achieve weight loss, it also helps to reverse the effect of the diabetes. So in University Malaya where I work, we have a great interest in these procedures because of our research in diabetic patients. So we have a lot of patients who are morbidly obese, very big size with diabetes, and after this kind of surgeries, their diabetes will resolve.
Wow,
so
how
these are our
interesting
current
is that?
interest in this
Very
field.
Now, cardiovascular diseases or symptoms as well gets resolved as well with this procedure.
With hypertension resolved.
With hypertension.
Yes.
How interesting.
Yes.
Okay, I'm curious, Fida.
Yes.
We saw you here.
Yeah.
And of course, the caption here is staple my stomach, which of course you didn't do. So tell us a little bit about, you know, what made you want to go through this, and how did you come up to the decision of doing this, as in, you know, going through that surgery?
Because before that, I have some problems about my body, has a problem with my spine, has some problem with my asthmatic, and then I just want to reduce everything to be healthy and play with my sons. So I have 2 kids, and just I just take a risk to everything, to take a risk to do all the Prof procedure.
Fantastic. I have to say, you look adorable both ways. You look adorable, sini so chomel, and now also so chomel, okay?
Okay, I'm sure it wasn't a sole decision on your own. What did Mr. Hubby say?
Wow, he's very
happy,
supportive.
Very, very happy.
But he was very supportive when you decided to go through the procedure.
Yes.
Okay. Now, doctor, coming back to you. Again, let's weigh this out. Now, for people out there who have an obesity problem, this probably is a good solution. However, there probably are people out there who feel this could be a quick fix to literally lose weight. Your advice on this? Because I'm quite sure people would look at it while health-wise, but also, you know, looking at it in another manner.
Yes, I'm very worried about future of Malaysia because the health of Malaysia suggests that we are going to become a fat country with the highest hotspot.
We're a fat country.
Fat country. We're going to be a fat country in 2015.
Okay.
And then we're going to have the highest prevalence of diabetes
Which
in
is
the
very
world.
true.
Wow. Yes.
Which is very true.
Because of that, I think we should look at the obesity problem seriously. But it's a pyramid of treatment, and we shouldn't look at surgery as a sole treatment. The best treatment still by and large by exercise and dietary. So majority of the population must still go through dietary and exercise, which Hilda has gone through as well.
Okay.
But it wasn't that successful. And then we look at some medications that might help the patients to lose weight.
Okay, I'm going to show.
Then we consider surgery.
I'm going to show another picture of Fida here. There we go. That's Fida. Oh, that was Fida again. So from here to what we see right now. For patients obese and ones with diabetes, as Fida mentioned, she had back problem. These probably would be a very good solution.
Yes.
What does the procedure entail? How do you what happens when a person comes to you, Fida for instance, who came to you and said, "Doctor, I need a solution to my problem. What can you do?" So if it is a person from outside viewing us right now, what would the whole process be like?
Well, first of all, he must come and see us, and we will have to perform a full assessment on his health.
Okay.
And then we do have guidelines to look at. We have Asia Pacific guidelines that look at the body mass index, which is the weight divided by the height square. And it's, if the body mass index is greater than 37, then the patient will qualify for this kind of procedure.
Oh, I see.
If body mass index is greater than 32 plus 2 other health-related problems related to the obesity, then the patients can be qualified for surgery as well. So we do have a guideline to adhere to.
Okay.
Okay. I have a question now. If I was 350 pounds right now, okay, I would be really big, and if I wanted to take up this procedure, this surgery, okay, and how long would it take for me to drop down, and how much can I drop? How many pounds can I drop?
Well, by and large, if you look at gastric bypass, you can lose about 70% of your excess weight, which is your overweight minus the ideal weight, the excess weight that you have. 70% of that, 60 or 70% of that by a gastric bypass. So this is kind of figure that we can work at.
Duration, please.
Duration, usually you can achieve that within a year. About a year.
Wow.
Yeah, by then it will stabilize.
Okay.
Okay. Coming back to Fida, I'm curious, as everyone out there, I'm quite sure would have many questions for you. Before I come to her, 2282-857-822-82-8579, give us a call, talk to Fida, talk to the doctor, give us a call if you're curious about this entire procedure, and if there's somebody in your family or loved ones or someone you know who might benefit from it, give us a ring. Fida, coming back to you, how was it for you post-surgery? I mean, again, you had to go through the fact that you had excess weight taken off you. So how was it for you post-surgery? Were there any side effects that came in? Did you have to watch your diet? Is there, anything that you had to do?
My diet, everything, and no side effect.
No side effects at all?
No side effect.
Do you still eat and crave for the food that you like, your nasi lemaks and everything?
Yeah,
you still eat them?
Yes, still
do.
eat. But I take a small portion from the.
Okay.
If I like to eat nasi lemak, I like to eat steak or everything. You can still enjoy the foods, everything. Can enjoy
more now.
Yeah.
Okay, but how does it work? Because before surgery, you have a pattern of eating. You have this habit of eating a lot. But does this whole surgery or this whole method, decreases your appetite?
Yes.
Does it?
Yes, it does, because we made a very small stomach pouch, and the part of the stomach produce hormones that make you to have the appetite. But because you bypass that, your appetite actually goes down. So it's early satiety, which means that you feel full after you have taken small amount of food. That's all you need. But we encourage our patients to eat small amount of food with high protein, nutritious food, so that you can overcome the problems of malnutrition.
Interesting.
Well, hold on to your horses. We do have a caller online. Good afternoon. Hello. Hi, who's online, please?
My name is Dato Haji Salim from Raw Pahang.
Yeah, Dato. Thank you for calling all the way from Pahang.
Yes, I'm quite happy since this program because I'm overweight also.
Ah, okay.
My weight is I'm 6'3", and my weight is 148.
Okay.
So I would like to know. First thing I want to know is whether can I go on this program, and second, what is the cost of it?
All right. Okay. Is that all, Dato?
And lastly,
Yes.
the durations of this surgery, how long does it take?
Right. All right,
Okay.
Dato. Thank you very much for watching us all the way from Pahang. Thank you very much. So there you go. He's 148, he's 6'3", and he wants to know how much it costs and whether he qualifies for this for the surgery.
Well, it depends on his body mass index.
BMI, yeah.
BMI, and he's quite tall. So I think his body mass index actually is not that high.
okay.
So if he's if he's 37 and above, then of course he would qualify for this kind of surgery, and he can choose which type of surgery he would like to go for.
Oh.
But if he is less than 32, less than 37, then I need to look at whether he does have any serious health problems.
37 in age, that is.
Yeah,
Okay.
and age is also a cut-off as well.
Right.
We normally look at between age 18 to 65.
Okay.
Yeah, because if it's age more than 65, the benefit that you get may not be that much. Because by and large, any patients who undergone this kind of surgery and can successfully lose weight,
Yep.
they can gain 10 years of their lifespan,
Wow.
an additional 10 years.
Fantastic.
Because we do know that the fatter you become, the more likely that you die early.
True.
Yeah, that's why FIDA is investing into her future.
Brilliant.
Fantastic.
Brilliant.
No, yeah.
I have a question because I've seen some cases, probably rare cases, where they were side effects, but not physically, but psychologically, where a patient would end up becoming very grumpy. I mean, have you heard of any of this type of cases before?
We normally screen them with a psychologist because what we don't want is patients who eat for comfort.
Yeah.
So if they cannot eat
Yes.
with this new pouch, they get very depressed.
Right.
So that will affect their lifestyle.
I
So we
see.
do screen them through. So if they do have psychological illness relating to eating habits,
Yes.
then automatically they won't be qualified for the program.
All right.
So it's a multidisciplinary group that we have.
Oh,
yeah.
okay. Fida, for our viewers out there, anyone watching you and looking at you and saying, "My God, I inspire to be like her," what's the advice you can give our viewers out there?
For the advice,
As a mom of two and as a housewife, as a wife, you know, how was it for you? Psychologically, how was it for you? Coming to terms with saying, I need to do something with my body.
because before this, I just asking you. I tell you about all my healthies, and I just want my healthy only. Then I'm last thinking, and then I go to Prof to help me, and then I just make a decision with Prof. How can I be slimmer, then reduce my pain, reduce all everything, then make me happy and with my family happy together with.
You're able to have a better quality of life. All right.
Dedication would
Yeah.
be-
Dedication.
yeah.
Well, we are going to go for a quick break. We're not leaving the doctor, nor are we
yet.
letting go the professor or
yet.
Fida. We're coming back to you. They're saying, you give us a call. We'll see you after the short break.